is, now you're a doctor, come on, you're getting old. He's a Dr. Giovanni BALDASSARRE. He is a postdoc in Udine with Bruno Grassi. It's a long time that he came here discussing stuff with us, so I'm very happy that you're here, Giovanni, again. And today he will present data about the passive leg movement technique, non-invasive method for assessing NO-mediated microvascular dysfunction in disuse and disease. Let's go.
Thank you for the introduction. It's a pleasure to be here. The passive leg movement technique has been identified in recent years as a non-invasive tool for the evaluation of the microvascular and endothelial function. This technique consists in the evaluation of the blood flow response in the common femoral artery by echodoppler during 1 minute of passive knee extension. And this movement, passive movement, determines a transient increase in the blood flow velocity, which has been proven to be primarily driven by the nitric oxide peripheral vasodilation. And by multiplying the data of the blood flow velocity by the cross-sectional area of the vessel, it is possible to obtain blood flow data. And as you can see in this graph, during this passive, so not active, but it's a passive movement, the blood flow can increase by as much as 4 to 5 times compared to the baseline in young active adults. But the hyperemic response during this passive movement is significantly blunted with aging and also with diseases. And considering the central role of peripheral of microvascular dysfunction in the pathogenesis of several chronic diseases, the evaluation of these aspects is of considerable importance. Therefore, this topic has become one of the main focuses of our research in the last years. And for today, I've decided to present you some of our data related to effect of disuse and some pathological condition on the peripheral vascular and endothelial function evaluated non-invasively by this non-invasive technique, the PLN. So as regards the first topic, that is the impact of inactivity on the microvascular function, we utilize two different models of disuse, the step reduction model and the prolonged bed rest. So as regards the first one, the step reduction consists in a sudden reduction in the habitual daily steps to a lower maximal steps limits, and when compared to the other forms of disuse, is generally considered a less extreme form of inactivity, closer to real-life conditions. Whereas, as regards the bed rest, this is a more extreme model of disuse that is generally used to simulate microgravity. So as regards the first study, this was part of a pre-project carried out in collaboration with the University of Pavia in Padova. We tested 38 young individuals, both before and after a step reduction from 8,000 daily steps to 1,500 daily steps. And the length of this intervention was 14 days. We evaluated the microvascular function before and after this step reduction by the PLN technique. So what did we observe? A significant decrease of the common femoral artery diameter, indicative of a structural change. What about the function? We observed also a significant decrease of the peak blood flow, a trend toward a decrease of the changes from baseline to the peak, but no changes of the area under the curve, which is one of the most representative parameters of the total hyperemic response, strongly associated with the nitric oxide bioavailability. So these data suggest a preserved microvascular and endothelial function after the step reduction. What about the bed rest? The bed rest study was carried out at the General Hospital of Isola in Slovenia. We enrolled a group of young individuals and also a group of elderly individuals. and they enrolled respectively a 21-day horizontal bed rest or a 10-day horizontal bed rest. What about the result? So we observed in the young, after 21 days of bed rest, a significant decrease of the common femoral artery diameter and also signs of reduced hyperemic response, indicative of impaired microvascular and endothelial function after 21 days of bed rest. And confirming also previous data by our group obtained after 10 days of bed rest in the young individuals. Signs of impaired microvascular and endothelial function were observed also in the group of elderly individuals, but after 10 days of bed rest and in the absence of structural changes. And an interesting aspect is that the data of the area under the curve obtained in the young individuals after 21 days of bed rest was not different from data observed in the elderly individuals that were almost 50 years older than these young individuals. What about the second topic? So the evaluation of the microvascular function in diseases. For this purpose, we studied two different patient populations, patients with the systemic sclerosis and COPD patients. The systemic sclerosis is a multi-system autoimmune disease characterized by vasculopathy, and endothelial dysfunction is a key mechanism in the pathogenesis of this disease. Whereas the COPD is a progressive lung disease, which is now characterized, which is now recognized to be characterized also by vascular dysfunction. So as regards the first study, we enrolled 21 scleroderma patients and 21 healthy controls. As you can see, the PLM elicited an hyperemic response in both groups. However, a significantly blunted response was observed in the group of patients compared to the controls, confirming the role of the nitric oxide-mediated microvascular dysfunction in this population. As regards the project on the COPD patient, this is an ongoing project, part of a BRIN project, carried out in collaboration with the University of Verona and Pavia. So far in Udine, we tested 7 COPD patients and 17 healthy control. So we did not observe any significant differences in terms of the main parameters evaluated, probably due to the low sample size. However, a trend towards a reduced hyperemic response was observed in a group of patients compared to the control. But again, these are preliminary data. We will see whether they will be confirmed by merging our data with those from Verona. So to conclude, signs of nitric oxide-mediated microvascular dysfunction were observed by the PLM technique after disuse, but only after bed rest, not the step reduction, likely being a more extreme model of disuse, and also in some pathological condition. So, to conclude, our result supports the role of the PLM as a non-invasive method for assessing the microvascular function, as well as for identifying potential therapeutic strategies. Thank you all for your attention.
Thank you, Giovanni. Questions? Sorry. I didn't understand what you meant. Sorry. Okay. I'm Massimo Venturelli from University of Verona. Good talk. I'm pretty sure that Russell Richardson will be really happy about all this data with PLM. And my recommendation is that when you're doing the PLM, and you have to normalize the data for the limb volume, especially for the COPD. Because you know the COPD have a severe sarcopenia in the leg. But if you don't normalize for the difference in the limb volume, the peak of the blood flow, the delta peak, but also the AUC will be completely misleading, is different. Okay, so my recommendation, also because you see a difference in the diameter of the artery, that is probably suggesting a change in the limb volume, probably related to the bed rest, and that is what also you will see in the COPD.
Thank you very much. You are completely right, because this is one of the most important aspect to consider when comparing the results between two different groups. So thank you very much.
Another great study. Well done. Just a quick question in terms of your primary take-home, and I know this is work in progress, the NO-mediated vascular dysfunction. Now we know with endothelial NO blockade, if you use, for example, LNMA, we're looking at 40 to 50% of this is probably NO-driven.
It's 80%.
80%?
Yeah. At least 80% related to the nitric oxide peripheral vasodilation. Yeah.
Okay, so I'm thinking back to some of the LNMA blockade studies that have shown a 50% reduction.
Okay.
So I guess the point I'm making is that there could be other factors, and it might not just be NO-driven. And one of the things with Russ's lab, which I think would be really cool, would be you can go femoral arterial, femoral venous, right? You can go transmuscular. And to measure, perhaps this is something you're thinking about, some of the NO moieties themselves. So some of the vasoactive NO, take some red blood cells, take some plasma, and make some measurements, and perhaps consider other factors as well, be it prostacyclin, EDHF, just to give a more global picture, I guess.
Thank you very much. Yeah, we focus just on these functional variables, but we know that there is a work behind. So we will, in the future, for sure, we will also investigate these mechanisms that are behind this functional response. Thank you very much.
If there is one quick, otherwise we switch. Yes, quick, sorry, Paolo, I forgot already.
Yeah, thanks for the talk, Paolo. Thank you, Università. I have a quick question regarding the measurement of the diameter, because I know it's a tricky measurement. What's your measurement error, actually, when you pick up the diameter? Because the difference was super tiny for the graph, and I wonder if it's within your measurement error.
Yeah, from some study in particular, which one, in general?
No, the data you present,
Okay.
there was significant difference in the diameter.
Yeah, significant.
But what is the measurement?
Are very, very slight, the changes, like 3%, but it's consistency on the subject. So it's like 0.2 millimeters. So it's very, very small differences, but it's consistency in the subject. So for this reason, this is a very low p-value.
Thank you, Giovanni. See you later.